For this project, I chose to focus on the concepts of empathy and community. In his article, The Refinement of Empathy, Tobin Hart discusses the fact that empathy is almost universally considered central to therapeutic practice, and that empathy varies much largely because of differences in activity of knowing. As knowing stretches into more direct, less inferential modes, distance between ourselves and others diminishes, and the possibility of deep empathy opens. So the more opportunities we have to be exposed to a variety of people and situations, the more likely we are to empathize with them. In addition, the research I found on community practices indicates that most research says that community-based resources should directly align with the specific needs of that community, and therefore they should be rooted in local contexts and responsive to changing needs and risks. The organization that I chose for this project, the United Way of the Concho Valley, reflects both of these concepts through the fundraising and allocation of local resources that they use to ensure that the community in a 14 county area here in Texas receive the resources they need for underserved populations. Examples of the services that they support include the Boys and Girls Club, the local YMCA, the Adult Enrichment Center, the Alcohol and Drug Abuse Council for the Concho Valley, the Adult Literacy Center, Big Brothers Big Sisters, Children's Advocacy Center, the Boys and Girls Club, Concho Valley Home for the Girls, Concho Valley Regional Food Bank, Esperanza Health and Dental Centers, the Institute of Cognitive Development, Girl Scouts of America, Boy Scouts of America, Salvation Army, San Angelo Early Childhood Center, and the Sonrisas Therapeutic Writing Program. In addition, the local United Way was responsible for creating a program called 211, where members of the community can call 211 and find out about resources available in the community to them. Also, they are involved in a program called Helping Hands, which is a ramp project that helps people that need money to have ramps added to their homes so that they can get in and out of their homes safely. Also, the local United Way is active in transportation, the transportation coalition of our local area, to ensure that they have input in the services being provided to the community. They also serve on the local hospital board to ensure that they can have input in programs that are being initiated on behalf of the obese children in our area, and to provide them with resources for becoming more healthy and knowledgeable about nutrition. They are responsible for the Emergency Food and Shelter Program by FEMA. They help oversee the facilitation of that program. And the money they receive is based on the census, and they cannot possibly receive all the funds they need to allocate services to those in need in our area. So they constantly are developing fundraisers to help reach their goal, and local community outreach programs in which local businesses allow their employees to contribute through payroll also to the United Way mission. One thing that I found interesting about this program was that I thought going into this project that because United Way is also a national organization, that each local organization would directly align with the needs of the national. But based on research regarding community needs needing to match up directly with the resources for that area, the same is the case for United Way, because each local United Way organization is allowed to choose their own mission and goals based on the needs of the community that they serve. I thought this was a very interesting project. I've served in the capacity of being a member on the community investment panel, and also was able to interview the vice president for our local organization. And through the community investment panel, I'm able to learn more about the providers and local organizations that United Way helps to fund and sponsor throughout the year. And I had an opportunity to review project applications for that funding, and therefore I was immersed in the goal and mission of the program by observing these resources actually doing the good that they're meant to do. My participation in this project gave me an opportunity to see firsthand the resources available in my community and the ways in which I can become more involved in a better representative of both of these concepts of empathy and community. Special thanks to United Way for allowing me to interview the Vice President and also for allowing me to be a part of the Community Impact Panel, because it's given me a new perspective on the community resources in my area.